Introducing RESTORE2, a deterioration and escalation tool for care homes.
National Early Warning Scores or NEWS are well established within the ambulance service and the acute settings, including emergency departments, but they are increasingly useful in community settings, including care homes and primary care. RESTORE2 makes NEWS accessible to community settings. It has four key components: the soft signs of deterioration leading into the National Early Warning Scores, a communication and escalation plan based on those scores, and a structured communication tool to ensure that people can communicate effectively. RESTORE2 can support GPs and primary care in a number of ways. Currently, there's a lack of available standardized assessment tools within community settings. Because RESTORE2 uses NEWS, which is standardized across all healthcare settings, there is a common language that can support primary care and GPs to assess residents and communicate. It's increasingly recognised that the complexity of the residents within care home settings has increased over the years. RESTORE2 can support GPs and care homes to understand what's normal for the resident and also detect deterioration using a validated tool. It's often difficult to achieve concise and effective communication between care homes and GP practices. Because using RESTORE2 gives a full set of observations, a NEWS, and it's communicated using a structured communication tool, GPs should have all the information they need to support their clinical decision making. Lastly, the number of calls from care homes to primary care can sometimes feel overwhelming. RESTORE2 supports care homes to assess who needs escalating and in what time frame. Some residents can be effectively and safely locally monitored rather than being escalated to a GP practice. For those patients who do need to be discussed with a GP practice, RESTORE2 enables GPs to triage and prioritise their caseload. The evidence is that by using the NEWS to triage and prioritise caseload, GPs can either reduce or at least maintain the current level of activity. The NEWS can support a GP to decide whether a home visit is required or whether a telephone consultation is suitable, and what time frame these interventions need to be delivered in. RESTORE2 and the NEWS also supports GPs to understand what's normal for their residents. Most residents, whether they're in a dementia, nursing or care home setting, have a NEWS score between 0 and 1, meaning they are not significantly physiologically deranged. Therefore, when the NEWS score is elevated, this is significant. Understanding what's normal for residents can support the GP clinical decision making. Lastly, RESTORE2 is closely linked to anticipatory care planning and deterioration in the community. It's really important that residents do have a clear end-of-life plan. This is not just about DNA CPR, but about their wishes about how and where they would like to be treated if they have an acute physical deterioration. GPs can support this process to ensure that the patient or resident is treated at the right place at the right time in the best way.
RESTORE2 is free to use and is available from the West Hampshire CCG website or NHS Creative. RESTORE2 has been designed to support carers to recognise and respond to physical deterioration. It was co-produced by West Hampshire CCG and Wessex Patient Safety Collaborative. It is free to use in its entirety and must be acknowledged if used as source material for other tools.